Hi, and welcome to this special presentation brought to you by Our Lady of Lourdes. I'm your host, Kelsey Higden. Today we're joined by Dr. Wissam Hanayneh, a hematology and oncology specialist from Our Lady of Lourdes J.D. Moncus Cancer Center. Over the next 15 minutes, we'll be discussing the latest advancements in breast cancer and learning about the comprehensive and compassionate care available right here in Acadiana. Dr. Hanane, thank you for being with me today. So you trained at the elite Moffitt Cancer Center, so you could practice anywhere. Tell me, what brought you to Lafayette, and how do you deliver your promise on providing large-scale technology from a large hospital to a small, close-knit community?
Yeah, so training at Moffitt Cancer Center, I was exposed to all the new technologies, clinical trials, all the cutting-edge treatments, and I wanted to provide that level of treatment in kind of a smaller community, in a close-knit community, where they're able to get world-class care while still being around their families, around their friends, without having to travel for hours and hours to get that kind of care. And so that's really like a big part of what drives me.
Yeah. What are the most recent significant advancements in treating breast cancer specifically?
Yeah, I think the unfortunate but good part about breast cancer being so ubiquitous is that there are so many treatments coming out all the time. I would say more recently, these new classes of drugs called antibody-drug conjugates, which are these really kind of very specific chemotherapy drugs that target the cancer itself, have really been revolutionizing what we do every day. But even over the past 20 years, there are so many success stories in the breast cancer world that keep pushing the envelope forward and providing better cure rates, better survival rates, to the point that I think it's probably one of the most researched aspects in oncology.
That's amazing. It's reassuring to hear that, because I know it affects so many women worldwide every single day.
Absolutely.
What is immunotherapy, and how does it factor into?
Yeah. So immunotherapy is actually these new classes of drugs, and the way that they work is they sort of take the brakes off of your immune system. And so it allows your immune system to essentially see the cancer and fight it. The caveat, though, is that it's not yet approved for all types of breast cancers. It's only for a specific part, as of right now, in what we call a triple negative breast cancer, which is the kind of more aggressive breast cancer that we actually see in younger women. And so that has also been a big revolutionary area that has really helped a lot of women.
That's interesting that you are seeing a more aggressive cancer in younger women. Is there any reason for that, or is that?
So there are a lot of factors involved, but I think a large part of it is genetic as well. Women, for example, that carry the BRCA gene, which is kind of the classical breast cancer gene, tend to have more of this kind of more aggressive type of breast cancer. And so that's at least explains part of it.
Mm-hmm. And you've spoken in the past and today about the resilience of your patients. How do they inspire your approach to treating breast cancer every day?
The way that I see them kind of maintain their strength and their bonds with their family, their faith, that is something very inspiring because they're able to kind of go through all the hardships, the uncertainty that comes with having a cancer diagnosis, yet still moving forward and doing all the things that they can do. That's a very inspiring thing to see, and it helps me be a better doctor for them.
Yeah. Walk me through a typical patient journey. What does that look like from beginning to end?
So we actually don't get involved as oncologists until the diagnosis is made. So very often, patients get diagnosed with an abnormal mammogram with their primary care doctor or their gynecologist or something like that. And then after a few more tests, once the biopsy is confirmed, that's when us as medical oncologists get involved. A lot of times they'll see a breast surgeon first, and then depending on the type of breast cancer, they may end up going to surgery first or coming to see me first to talk about treatments before they get their surgery done. Mm-hmm. So that's probably the most common pathway that it goes. as a medical oncologist, I end up following them after surgery for many, many years, and a lot of the times for their entire lifetime. And so we really established this kind of long-term longitudinal connection with patients, not only after treating the breast cancer, but in terms of watching for recurrence, making sure it doesn't come back, managing the side effects from treatment, long-term side effects, and kind of being on top of any new treatments that may be useful for the patient years later.
And that kind of leads me into my next question, which is that patients will see an oncologist for longer than they're seeing their other doctors throughout the process. And I think you kind of are going into why that is. So why exactly is that they'll stay with you for so much longer?
So for the most common subtype of breast cancer, for example, which is hormone-positive breast cancer, there are cases of very late recurrences 10, 20 years down the line where the cancer can even come back years down the line. And so we maintain that relationship so that they always have somebody that they can kind of, check in with if they have concerning symptoms, if they have long-term side effects from treatments that we do. These are things that they can always check in with me to kind of look into in the future.
And are there different types of breast cancer, and how do each of those different types differ in the treatment process and everything that goes into that? Sure.
There's a lot of nuance, but generally we separate breast cancer into kind of three big buckets. And so the biggest bucket of them is what we call hormone-positive breast cancer. That's by far the most common. And that's the one that is very well detected with mammograms. That's usually kind of a slower growing breast cancer. That one is the one that we treat with hormone blockers, and that's usually the one that has the ability to come back years down the line. There are less common types of breast cancer, for example, triple negative breast cancer, which is more associated with the BRCA gene. That's the one that has more aggressive features, more common in younger women as well. And there's that third bucket, which is what we call a HER2 positive breast cancer. HER2 just stands for a protein that's expressed on the cancer itself. That's also kind of an aggressive subtype, but with really good treatments. And so that's kind of the most important and the first question that any medical oncologist asks is, what kind of breast cancer are we dealing with? Because it really changes a lot of the treatments that we do.
Yeah. What age would you advise anyone to start getting tested for breast cancer?
So, most national guidelines recommend starting at the age of 40 for women at average risk, meaning these are women that do not have a well-known genetic syndrome. These are women that have not received radiation to the chest, usually at age 40, every 1 to 2 years. Mm-hmm. For women that are at higher risk, that age can be as young as 25. Mm-hmm. So it really depends on each individual patient. But for the general public, it's about age 40.
And what are some common risk factors that go into developing breast cancer?
Yeah, so other than the genetic factors, which are fairly strong, a lot of women do not have a family history, yet they still develop it. And there are some common risk factors. For example, hormone replacement therapy. There is early menarche, which is very early age of when they get their first menstrual cycle, and then late menopause. So having that very prolonged duration of exposure to the own bodily hormones. That's kind of a big risk factor there too. But even in terms of diet, alcohol has been shown, even at low levels, to increase the risk of breast cancer. And so, typically if somebody doesn't drink, we usually don't tell them to start drinking.
Right. Finally, for a listener who has just received a breast cancer diagnosis, what would your advice to them be, and just what words would you give them?
So first thing I would say is that you're not going through this alone. You have a lot of support from your medical teams. You're going to have a surgeon, you're going to have a radiation oncologist, you're going to have a medical oncologist, all kind of supporting you throughout the entire process. And know that there's a lot of science out there. There are a lot of treatments coming up all the time. And so it's okay to be afraid, but we are there to support you throughout the entire process.
Yeah. Dr. Hanane, thank you so much for shedding light on such a complex but hopeful area of medicine. Your insights into the latest treatments and the importance of personalized patient care have been incredibly valuable. It's clear that with a dedicated team and cutting-edge technology, there is lots of hope for anyone going through a breast cancer diagnosis. On behalf of Our Lady of Lourdes, thank you for joining us. To learn more, visit lourdesrmc.org. www.immunotherapy.com/cancer. I'm your host, Kelsey Higden. We'll see you next time.